Hello and welcome. My name is Dennis Horn. I am the Diversity Services Coordinator at the Fresno County Department of Behavioral Health, and you are tuned in to a panel discussion, the necessity of Black service providers. This is a part of the department's efforts around education and outreach for Black History Month. Today, we have three esteemed guests joining us to discuss this very important topic, and I won't introduce them. I'll have them do it themselves. So without further ado, I'd like to I'm saying I'm not going to introduce, but without further ado, Miss Warren, if you'd like to introduce yourself, and we'll go clockwise. So Dr. Thomas next and Dr. Jones after her.
Okay, hello everybody. My name is Jaryn Warren. I'm a licensed marriage and family therapist in Fresno, California, and the owner of Joy 360 Wellness, formerly known as Expressions Counseling Center.
Good afternoon, everyone. I'm Dr. Reshale Thomas. I'm a licensed clinical psychologist, and I am the owner of LA Psychological Services in Fresno.
Hello, everyone. I'm Dr. Jones. I am a clinical psychologist. I'm the president and founder of Handle It Helping Hands, where we provide mental health services.
All right, thank you. So I know all of you to some extent, or are passive cross, but I don't know all about your journey to this work, to this very important work that you're doing. And I like to know, and we can answer in any order, whoever feels led. How were you introduced to work in this field? What motivated you? What inspired you? What life experiences did you have that led you to this point and to this work? So whoever would like to answer first. Or maybe
okay, I'll jump right in.
Thank you.
I'll bail us out here. I knew that I wanted to be in mental health pretty much like my entire life. No, I'm joking. I'm totally joking about that. I did not. What motivated me was I was in undergrad and I was pursuing a degree in music, but then I felt like I probably wouldn't be able to have a career. So I said, by my junior year, I said, what is the shortest major in this school that will help me graduate on time? Because I don't want to be a super senior. So I looked at the catalog and I said, boom, psychology. I'm a psych major. So that started my journey in psychology. When I graduated, I realized, there are no jobs. So then I applied to graduate school and went to graduate school. And somewhere along the way, I kind of I hit my stride, I hit my rhythm, and it happened to be a good fit. So that is how I got into this field.
Okay, I like that. Unorthodox, but you're here now.
No, I think that's great because mine is very similar. People ask all the time, how do you become a therapist? And I'm like, low self-esteem. I really think it started off because, in high school, I always felt like you had to be good at math or science for stuff. And then I got to college. I'm not good at math or science, not life science. So I started off as a film and electronic arts major at Cal State Long Beach. I was going to make movies. But somewhere along the way, that just wasn't the field for me. And I had to find something that didn't involve a lot of math or a lot of science. And so I took the family life education route. And I loved it. It was very practical on just working with people on budgeting and communication and life stuff. And then from then on, once again, same, like what job do I get with family life education? So then it led me to grad school to do therapy. So that's kind of the path I took.
So we have a musician, a movie maker. Dr. Jones, I know you have a unique background as well. Tell us about your genesis in this work.
Mine's a little different. I started off in technology, so I'm known for my background in technology. That brought me to psychology because I wanted to merge my experience with technology with artificial intelligence and virtual reality. So in order to understand how the mind works, you need to know about psychology. So that's how I end up getting into psychology. However, getting into the psychology field taught me a lot about what I didn't see in my past. So what I saw in my past ended up being mental health disorders, but going to graduate school, getting my PhD brought that to light. So that's how I came to become a part of the psychology field.
Wow, so like three very different paths, but all led you to something really impactful, doing something really impactful. Not that the other things aren't, but this is why we're here today. So I want to know, like, did any of you face challenges in seeking a career in this work? And we'll talk a little bit later about building your business and your organization. But were there any challenges that any of you faced in pursuing a career in mental health? I know, Jaryn, you spoke about there not being jobs. So maybe speak to that or something else.
Yeah, well, I think honestly, the biggest challenge for myself in this path I've been taking is, so I have an autoimmune disorder, which is probably, not that all of them don't have their own challenges, but mine is probably one of the worst to have as a therapist because it affects my mouth. So I get lots of mouth sores and I cannot talk and I cannot speak and I cannot do what I need to do as a therapist to, help people. So that has mainly been kind of the challenges of medical illness. And this has been going on since, 19 years old. My entire adult life basically has been with this challenge. So that's probably been the hardest thing. And as I did get jobs in the mental health field, it was hard to implement self-care because a lot of places want you to work your 40-hour week. They schedule you 7 clients a day back to back. And so it was hard for me to implement self-care working for these other places when it hurts for me to speak and to do what I have to do. And then the guilt would come in, like, I have to cancel sessions today because it hurts to speak. And then I'd end up working anyway because I don't want to disappoint people or because I don't want my employer to get mad for taking time off. And it was just really hard for me navigating that. So I know I jumped ahead. That was one of my reasons why I kind of fell into opening my private practice to give me a little bit more flexibility. But that really has been my biggest challenge, managing illness, but also trying to practice what I preach, which is self-care at the same time. So that's kind of my story and journey.
Thank you for that. Thank you.
For me, one of the biggest challenges as a psychologist, and it's regional, right? So psychologists are everywhere in like the LA area, in the Bay Area, in some other states, but here in the Valley, there aren't a lot of like public services that utilize psychologists, like the psychologist specific services. So jobs, like job opportunities, that was one. I remember first starting out after grad school, I was making like $15 an hour, part-time. And I remember like being on food stamps and things like as a doctor. So definitely the job market and knowing, had I known then what I know now, doing better research about like what are the services that are utilized in your community, but then also, and like Jaryn, this goes into partly how I ended up starting my business. It was out of necessity. Like if there are no opportunities, well, then I'll just create them because where there's a will, there's a way.
No, that's actually, like you said, you skipped ahead and you guys are answering the question that I have for you later, but that's really important to note because I wanted to know, why was it necessary to start your own business? And now we see, not everything, is going to be an easy road or easy pathway. So it's good to know, what folks are up against, because in this discussion, we also want to know, how folks who are coming up, how they can pursue a career like yours. So it's good for them to know all sides of it. So I wanted to know as well, what in your background or what inspired you really to want to pursue like this career in promoting mental wellness? I heard a little bit from Dr. Jones, and I don't know if you want to speak to that more, but we recognize that there are disparities in the Black community. And although you may not be serving specifically the Black community, but Why is that important? Like what really drove you to wanting to promote mental wellness?
For me, mental health in the Black community is important. And I specifically target the Black community. So my programs, from conflict resolution, to even helping the little kid that's having a tantrum that doesn't even understand why am I having a tantrum, all of my services are targeted towards the Black community. And that was my inspiration as well, for getting into this field, to becoming a clinical psychologist. Just the stigma itself in our community, and being a Black man and having to already suppress emotions, getting in the field taught me that, hey, we need to better address our Black men, and that will better address our nuclear families and our newly modernized families of today. But we have to start somewhere. So that was kind of my inspiration for taking my the technology side of things that always pull me in. It's always technology out there. Someone always wants me to fix a computer, do something on a technology level. It's really hard to stay away from that when our Black people are suffering. So again, that's my target, is the Black community.
Thank you for that.
Yeah, kind of going along with that, and along with like the job opportunities, one of the only places that you will see a psychologist in the Central Valley utilized the most is in the prison system. And that's, I didn't go to Alliant. I'm not a forensic psychologist. And it's really unfortunate, especially when we look at the disproportionate rates of, Black and brown bodies being incarcerated. I don't want to be at the end point when when we're trying to rehabilitate people who are already caught up in that system. So, being a psychologist in the private practice sector gives me an opportunity to intervene earlier in that cycle. And what Dr. Jones was saying, like, you want to give people the tools before they get to that end point. You want to pull them out of the, school to prison pipeline early in that process, or before they even get there. And that's why being in the private sector is really, really important, not just for people in general, but especially for the Black community. Who would benefit greater from being able to see someone in the private sector before than the Black community?
Yeah, and piggybacking off of that, I think one of my biggest passions, and as I work with my clients, and we definitely at Joy 360, we do target Black women, but also just people of color. But one of my biggest passions and who my ideal clients really are people who need to learn self-care skills. Like I said, that's been a piece of my journey, is learning how to take care of myself. And how many of our mothers and grandmothers and aunties have we seen who will work themselves to death and not knowing what self-care is, not knowing when to take a break, not knowing how to take care of themselves. And so that's really a message that we, really push when we work with clients, is identifying what is self-care, how can you take care of yourself. And then also, because there's disproportionate rates of just illness, right, in the Black community in general. And so teaching wellness things that we may not have known, even just focusing on getting enough sleep. How do you handle your stress? Because a lot of these things we haven't been taught, which is probably where some of the disease comes from. Stress kills us. So we do need to help our community and teach and instill these skills so that, our children and nieces and nephews, right, they can learn these a lot sooner than we have. And so that's kind of where Joy 360 is, just all about just all-encompassing wellness. So, yeah.
No, thank you for that, Jaryn. The need for that proactive versus reactive service, and support is there. And, we talk a lot about, here at the department, within my division, how so often members of our community are seeking services because they got a referral from somewhere. They have to do it, right? And it makes it just so much more like important for us to do something, something you want to do to improve your life versus being something that you have to do in order to get something else, right? So it brings to mind like the question, like, so how do we get folks, how do we get to them? How do we have those conversations? With, of course, stigma around mental health in the community is still very prevalent. So how do we reach folks, before, I won't say it's too late, but before they have to seek support?
I think that's a great question. And it also speaks to the rather antiquated theories about privacy and self-disclosure in the therapeutic space as a clinician. I think doing things like this, panels like this, where you're accessible to the community is really, really, really important. And there aren't necessarily a lot of, just in terms of professional development, like ethics specifically geared toward what you do as a clinician who also does outreach. So most of the time I will get my clients from speaking engagements, but I will also get them because they recognize me in the store. I live in West Fresno. So people will recognize me in the store, or I'll just be talking to someone in, at the mall or something like that, and they find it easy for me to talk to. And that is how, you engage the communities. You get out there. You don't wait for them to come to you, because really by the time they do come to you, whether it's by referral or court mandated, or even just a family members are telling you, you need to go and get some help, like you're a problem. By the time someone comes to you, it's really not 100% voluntary anyway. So being able to go and reach people where they are is one of the best ways, just being accessible and knowing that, in your training, you're basically invisible to the world outside of the therapy office, but that is not how we reach our community. So figuring out how to navigate that space.
Yes.
I'm gonna always go last. I was raised that way. So Dr. Warren, if you want to go first, I'm gonna always wait for you two ladies first. So just understand that. That's why I'm being patient. Just kind of going off what Dr. Thomas was saying and elaborating on that, we have to do more panels like these, but we have to get out in the community and let the community know we exist. And meaning we exist like a Black psychologist, an African-American psychologist, a psychologist of color, and know that we're in a community doing community service, even if we're getting paid and have a private practice, right? For Handle It Helping Hands, we're trying to figure out how to give these services away for free. You can't always afford mental health care. That's a barrier. So that's what they don't know what psychological health care looks like. They know that people say, oh, you're a problem, you're an issue, you're bad. Well, let's be honest, stop calling them bad. Tell them, hey, we need a solution to that behavior instead of calling our kids bad and you're horrible, you're terrible. Let's change the way we talk to them, and we can change the way they hear words so they'll think more positive. So at the end of the day, I think, even going to the challenges of being a Black psychologist is bringing an awareness to our community, because our community don't know what even Black medical care look like outside of being discriminated against. As a Black man, I can't go to the doctor and see the doctor without them telling me, oh, we know you probably got high blood pressure. Why? Because I'm a Black man. So at the end of the day, we need to have these conversations with our Black children to let them know having a mental health disorder is not bad. You just need to find a solution, talk to a psychologist, and we need to show them that talking to a psychologist is okay. And we do that by going in the community, and we do that by networking with each other, right? So we need to build a Black network. of psychologists. I mean, I'm a part of the Association of Black Psychologists, but we need our own in-house network. If we're all in Fresno, California, and we're all trying to do mental health care, mental health or mental wellness, we need to come together and let our communities know we exist. And when they start seeing us, then they'll be more inclined to come to us for help or even help, period. And let them know that we keep secrets better than their best friends, right? We have ethical standards we have to follow, confidentiality agreements. We won't tell on you.
No, and I think that as you were speaking, I was definitely thinking of the importance of networking, because there's so many times, I have a staff of, Black therapists as well. So there's so many times people are referred from somebody who knows me, and it's like, sorry, can't be your therapist. But if we're not networking and we aren't out there, communicating with other Black therapists out there, like, who do I send you to then? Because as much as I want to see you because I can help, I can't. Ethically, you can't do it. And so that's a challenge that I find myself running into a lot within my practice, is that people are coming to us because we are Black therapists, but I know you, or you are on the choir with my mom or dance with my sisters. Like, I can't be your therapist. So I need to make more connections out there to be able to refer them, because people are seeking Black therapists right now.
Yeah, that's perfect for actually what I wanted to touch on. I mean, we know there's a shortage, right? There's a shortage of Black therapists. I know there is in Fresno County, and I imagine that other areas are experiencing the same thing. So, that network is super important. That, if that's not taking place now, it should. And once that happens, and folks are, coming in seeking support, like as I think a couple of you mentioned, they want to see Black therapists specifically. Like, why is that important? Why is it important to have someone who looks like you, who may have similar experience to you, providing this mental health support? And thank you, Dr. Jones, who just dropped a statistic in our chat here. There's 41,000 psychologists in the U.S. and 4% of them are Black. So we see the shortage. It's real and it's nationwide. So why is it important, though, for our community to see someone who looks like them when they come in for mental health services?
Well, so a time in my life, I did struggle with depression. And I went to see a therapist who was not Black here in Fresno. And I remember she basically argued with me that I wasn't depressed. Her line of questioning was like, well, aren't you going to work? And I'm thinking, is that an option for me not to go to work? Are you still doing this? And I think that, once again, depression and other things, they may not look the same in us as they look in other people. And then we are written off because you're not really depressed, right? You're not really depressed because you're still going to work. And so that was an experience I had with somebody in our field, just feeling completely invalidated and dismissed, and arguing with me, another therapist, that you're not really depressed. And I, because I am a therapist, I know, like, no, you're wrong. And I can advocate, but so many other people may not be able to advocate for themselves. And that experience for myself is one of those reasons why I do think it's important for there to be more Black mental health clinicians out there, just providers in general. Even thinking of the research that happened on Black infant mortality, and where it came out that Black babies are dying more often when they have white providers. It's those type of things, which is pointing to why it is important for us to be present in the mental health or medical field, wellness field, whatever, because I think that we can relate to each other a little bit more, but also we're looking for things, and we might offer a little bit more care than somebody else would. I think Dr. Jones, you had mentioned just feeling dismissed at the doctor's office, where they just feel like they know you already and they write you off. Like, these are experiences that a lot of us are happen, right? I think on my caseload in like 2019, there were 3 Black women that came to me. all of them were professional, or they were of higher education. They had experience being involuntarily hospitalized, but it was like for wrong reasons, or like, I'm not suicidal. And it's basically being kidnapped, right? Like, we don't have any room for you in Fresno. They're shipped off to Whittier, someplace, no ways to get back, and causing more trauma. And all of them were like, but I wasn't suicidal and I wasn't a risk to myself. This person didn't listen to me. And so all three were Black women that I had in like the year 2019 or 18. And so it's those experiences and those stories which point to the importance of why we need to be there, and why Black providers are so important.
I agree completely. It's really important to have representation in the field, because, as you know, many of us who have been trained, I remember in school, the diversity courses, the theory of, you know, praxis and pedagogy is, well, as providers, you will see that the assumption is always that the provider is white or non-Black. So when they teach you how to engage with diverse populations, not only is the assumption that the therapist or the practitioner, the provider is white, but that the other non-white person is poor. Like, Black is synonymous with poor, synonymous with lack of opportunity. And I found that really, really problematic. And if there are no people studying to be providers, then that goes unchecked. So you get indoctrinated. Even like as a Black provider, I had to really, like, you know, keep that in mind and check myself, thinking like, wait, I am not a white provider. I cannot approach the therapy situation in the way that is being taught. So just not only representation on the provider side, but even in the educational side, like those who are training practitioners to be. Because when you go to the therapeutic situation and the service situation with that kind of worldview, it does not go well. It does not go well with Black clients in particular, because they are very, very proud, a lot of them. Like, very proud, like, you don't have to come at me like that. I don't need your pity. I need solutions so I can go on about my life. So yeah.
And I will add to that the importance of Black providers, it stems from what I was saying earlier. You know, when our communities see us, they can relate to us. So the more Black mental health providers and even medical doctors, the more our community can relate, and the more the commonality comes out. Now it's common to see a Black doctor, a Black pilot, a Black psychologist. Now I feel more comfortable with utilizing those services. I said Black pilot for a personal reason, right? I don't like to fly, but maybe I'll be okay with flying if I see more Black pilots. I don't know. You know, it's just a theory of mine. However, when we start interacting with our community on those professional levels, then our community become more comfortable with that profession, right? And I'm gonna say something, I hope I don't offend nobody, but at the end of the day, you know, sagging pants become common because of our hip hop culture, right? Nothing's wrong with the hip hop culture, but why don't we have hip hop psychologists, so to speak? Let's make a psychologist a hip hop star. So going to see a psychologist becomes common, becomes second nature. And I just use that so it can be something dramatic. You know, hey, if that's the way you dress and that's your culture and your hip hop look, I'm fine with that. What I'm saying is, if we can go ahead and transition that type of rock star status to Black professionals, then maybe we can start, you know, grabbing our youth. And that's really where we have to start getting them is at a young age. And then we can change that infant mortality rate, right? So.
No, that's great, Dr. Jones. I mean, what I'm hearing is, of course, our community needs to be aware that there are Black service providers. one, right? Then we need to be able to offer that culturally, like not just culturally sensitive, but culturally similar, like care, right? Like we're not a monolith, but we do have shared experiences. The Black community certainly has some very similar experiences and just nuances of the culture that maybe another provider is not able to identify with. So super important, super important. And that leads me to my next question. So and you started to touch on this, Dr. Jones. So I know you said you're gonna go last, so I'm gonna respect that. But what are some ways, some unique approaches to providing service that maybe you're engaged in, or that you have seen have some measure of success in the Black community that whether it's out of necessity or it just doesn't work as well with other patients or clients or persons that we serve? Are there ways that it's better to reach the Black community than other ways?
I think just, being on this forum is one of those ways. It doesn't seem unique because, the virtual world is reality now. However, it's a way of reaching a mass of people in one common place. So if we can have free, online webinars about, let me look at some of my depression or stress, right? These are just some of the programs we provide, and we just do them free and just do some just quick workshops on how to alleviate anxiety. We're going through a pandemic. Just do a free workshop. You're not getting paid, and technically you are, right? And we start putting it out there to the Black community, to anybody, but of course we want to get it out there to the Black community. Another unique way is giving the service away for free, so to speak. So we get grants. That's why I started a nonprofit. So we'll get grants, and then we can provide these services for free. Another unique way. It's not free on the back end. However, because of the ones that can't afford the healthcare or the mental health care, now they can afford it. So it's a unique way of them getting those services, right? And then Dr. Warren, she was talking about her friends coming to her. For you guys who don't know, we can't wear dual hats. That's called that means you're wearing a dual hat. However, Dr. Warren and Dr. Thomas, we know that all our family comes to us when they have issues. How on paper, we can talk to you just regular, but on paper, we can't, I need to say, hey, cousin Starter Pistol, I need you to go talk to Dr. Warren, right? Or Dr. Thomas. I can't be a psychologist. The dual relationship thing won't work. However, those are some of the unique ways I see that we can really start grabbing our Black community and bringing awareness to mental health, and even mental health titles, so to speak, how we talk about stress, anxiety, PTSD. The Black community don't know what those words mean. However, what it looks like. If we do some workshops, at least they can see what it looked like, so they can say, wait a minute, I am suffering from PTSD, or possibly I am. So let me go seek a psychologist for that. So
really breaking those barriers down, right? The access barriers is what you're speaking to right there, is, whether it's cost or, just even when we talk about offering services via online, whether it's a seminar of some sort, that is addressing the barrier of transportation even. So, those are things that certainly, our community is at a disadvantage when it comes to that. We know that those barriers exist. So I like that. And of course, the familial thing, right? If that network that we spoke about before is formed, then it's easier for me to be like, all right, I can't help you, but Dr. Thomas can help you, or one of, the therapists at Joy 360 can help you. So yeah, I like that. I like that. Anything else in terms of like unique or creative ways?
Yes, I think that in working with my clients and my Black clients in particular, a lot of the times they will come to me because they're frustrated with other providers with the labels. Like, they labeled me as this. Now, sometimes the clinical label will be spot on. It will be spot on. They just don't want to hear it from that person. So I find that, it does you no good to get into semantic arguments with your client. Like, I had a client tell me, I said, well, how long have you been experiencing depression, based on the symptoms? And she was like, first of all, doc, I really don't receive that. I don't receive that. I am not depressed. And I'm like, okay, well, what would you call it? Well, I just feel, sad and empty. Okay, well, then how can we, then our goal needs to be to get you to feel less sad and less empty. We want you to feel more fulfilled. So and that approach works really, really well, especially with my Black clients, because of the labels in our history in, the healthcare system. No one wants to be pathologized. No one wants to, always be the sick person, the symptom bearer. I don't care what you call it, as long as you're sitting in front of me and we're working on getting it fixed. Now, I do tell them, because of, insurance purposes, I will call it this, but between you and me, this is what we're going to call it. And we're going to create our goals around that. So really being flexible about how you talk to, you don't have to throw around psychobabble. You do not have to throw around the big words. Just connect with people. I feel sad. Okay, how can we get you to feel joy?
And piggybacking off of that, I think just being an authentic presence in the room. I know way back when I first started therapy, I thought that as a therapist, I had to be a certain way, talk a certain way, because that's all we saw was this is what an image of a therapist is. But I'm finding that, well, with most people, but also, Black clients in general, being an authentic person, not feeling like I have to code switch or change up my speech patterns or do anything, just showing up the way that Jaryn shows up. And this is who I am as a person. This is who I am as your therapist. Let's talk. And I think that there's an appreciation that comes from like, this person's going to be real. And like Dr. Thomas said, not throwing around psychobabble and stuff like, what are you talking about? Just speak to me like a person. I think that is something that will be effective, because I want people to speak to me like a person, not like the problem, right? Or I think I've worked with a clinician in the past who, had this whole blank slate type of demeanor where I'm not going to show any emotions and I'm going to basically, seems like being a robot. And I think that a lot of times as Black clinicians, kind of like Dr. Thomas talked about earlier, like we learn all these theories and stuff that were created by old white men. And this is how you're supposed to be as a therapist, but that's not how it's going to work with my population. This work with your population, that ain't working with my population. So being able to take tenets from that, but also turn it into what's going to be most effective, which is me just showing up as a human being, speaking to a human being.
Yeah, that's called building rapport, right? That's how we build rapport with our Black community.
Yeah, absolutely. And I think that's important too, that authenticity, that goes such a long way in the community, in and outside of a clinical setting. So that is certainly, something that we ought to center when we are looking to provide services to the Black community. So I wonder, the Black community in the U.S. has been through a lot, like since the ships landed. Like, we know that, and obviously with the advent and the advancement of social media and just media in general, like we have a front row seat to a lot of the injustices and horrors that our community still faces today. And of course, all that's been really amplified in the last couple of years, even prior to the pandemic. Like, I want to know, like, are we seeing any trends in Black folks seeking mental health support? Either way, increase, decrease, just the conversation, is it advancing? What are your observations on that?
I've seen a definite increase, especially since COVID. Now, here's the thing. They're not seeing me because of COVID. They're not seeing me because of the stress of COVID. And I'm seeing not just an increase in Black clients in particular, but Black working clients, right? Because when everything shut down, now a lot of people, you have nothing but time on your hands to sit with yourself and your thoughts and your past. So a lot of the times I'm seeing people who are seeking services for old stuff, like old trauma, old, problems with relationships, because now you can't get away from your household, and even with work stress, being how transitioning back physically to work is stressful, and people are like, have heart palpitations and stress, just because of, being Black in the workspace, or even just being a stressed out person in the work space. So I'm seeing lots of people who are coming in for, delayed maintenance, as it were. Mm-hmm.
And what I'm also noticing, kind of the same, I'm seeing a lot of people coming in, and I think kind of like Reshale, COVID could be the excuse, but it's all the other stuff we're working on that has nothing to do with COVID. But I'm also noticing that it's becoming more accepted to go to therapy, right? It's like my cousin told me about your services and they really got a lot out of it. So I think it's time for me to try this out. I've been curious. I just never, took the step to do it. Like that's a lot of what I'm seeing now, is that it's becoming more accepted. And maybe the pandemic helped with that, to give people a reason to initiate services because of some of the hardships that happen. But, thankfully, because they're realizing that, wow, this isn't scary. This isn't bad. This isn't, everything I thought therapy would be. It's an actual different experience that I'm getting a lot out of. And they're spreading the news. So other people are becoming more open to taking that step too.
So that speaks to Mr. Horn, when you said, is the conversation advancing? So we just heard right there, and it is. We are seeing more individuals, period, seeking mental health care because the conversation is out there now. And of course, it did start with self-care. Like, hey, now that we are online, we need to do better at self-care, taking care of ourselves. And that started spreading into mental health care. So the conversation is advancing, and we are seeing a uptick in mental health individuals seeking mental health services, no matter what part, whether it's mandated, court mandated, or just regular, but we're at home and people are needing more court ordered mandated services, which is not a good thing, but hey, we are seeing an uptick on both sides. That's what I'm trying to say.
And I like what you all have said. It's becoming more accepted. Like it's not the secret, that it once was in the community. Obviously there's still a long way to go. Again, stigma's still there, but it's something that we're likely to share with a cousin or with a friend. It's like, hey, I've done this. I was just, having a similar conversation with someone the other day. I said, I'll do a little shameless plug. The department has these mental health awareness pins that incorporate the colors of the Pan-African flag. So I've been telling everybody about them, trying to give them away everywhere I go, right? So the lady who does my locks, my hair, it's like, hey, can I give you one? And can I put a poster up? And she was telling me, yeah, somebody was telling me about their great therapist, and I think I'm going to call them. I'm like, that's what it's all about, right? That's like, even if it's just some, minor, really minute way to promote this conversation and to really promote being a happier, healthier, like that is what we want. And I'm so glad to hear that conversation has become more prevalent in the Black community. So I want to shift the conversation a little bit. We talked about, actually, let's not shift. Self-care has come up a couple of times in the conversation. Like, what does that mean? What does that mean for you? Like, what do you do? What do you engage in? What are some resources and tips that you might provide for someone who is, wanting to really mind their personal wellness, and maybe they're in therapy, maybe they're not. Tell me a little bit about self-care, your routine, and so on. Anyone?
I guess I'll jump in and keep in mind I am a work in progress here myself.
We all are. We all are.
But I feel like a lot of times self-care is like that buzzword, and it's like this elusive thing that nobody really knows what it is, or maybe it's going to spend money to get your hair and your nails done. But it really doesn't even have to be that. Like self-care can be you're sleepy, and instead of staying up to watch the next show on Netflix, you decide it's time for me to go to bed because my body is telling me I'm tired. It can be, I struggle with drinking water, so I have my water here because I know that I need to stay hydrated. It might be getting up and stretching, or deciding that, I've worked a lot. I'm going to turn my computer down and I'm just going to go listen to music and rest for a little bit. Like self-care doesn't have to be something you have to spend money on. It's really, to me, about checking in and asking, like, what do I need right now? And taking those steps to make it happen. So now to actually answer your question, as far as my self-care, I enjoy painting. It's something that brings me joy and peace, and it's relaxing. I enjoy listening to music and shutting down, turning off the television, and maybe just laying down and just listening to music at night. Those are probably, and then I do enjoy my bath times, candles and music as well. So those are a piece of what I do for myself and try to get a little bit of something in throughout my week, just to help me cope and manage and get more rest. And I religiously go to bed at like 10 o'clock because I get sleepy. So 10 o'clock is my bedtime and I'm going to bed at 10. Don't call me, don't text me. Phone's on, do not disturb. So those are some of my things.
I walk. I love to walk. I love to work out. I'm trying to work my way back into the gym, in the midst of a pandemic. Music is always something that I enjoy. And I agree with Jaryn. Like, I make it a point to make my self-care something that you don't have to spend money on. Really just taking care of yourself, because a lot of people will neglect to, engage in self-care behaviors because they think, well, I can't afford to. Like, well, you can, even if it's time, even if it's better time management. And one of the most concrete ways for me personally that I do that is I only work a 4-day work week. Work 4 days a week. We're closed on Fridays. You call, you're going to get a message. You're just going to leave a message. The office is closed. So anybody out there who, is a registered psychological assistant, that's a perk. Come on and see us work a 4-day work week. We need some help here.
Now hiring, y'all heard that out there.
I would say that recognizing that you are staying up late, like Dr. Warren said, and saying, hey, I'm turning it off. You have to recognize it first. I'll talk to my mom on the phone and she'll be like, okay, I'm losing you because I'm always working. So my mom can even recognize when I'm working. That's how bad I'm always working on a project, whether it's for somebody else or for myself. So for me, I use the word spontaneous. I will drop everything after this panel and go to Magic Mountain and be somewhere. And you're like, wait a minute, what? I'm gone. That's how I self-care. I'll end up in Arizona or Vegas. My mom called me this morning, was like, what part of the world are you in? Because I become spontaneous to get away. Because if I'm at home, I'm gonna find a way to work. If I'm at the office, I'm gonna find a way to work. I'm gonna find something to do. So for me, the tip would be to recognize what you need to do to self-care. Recognize those things that, keep you working and keep you, mentally stimulated at all times. Well, you need a break. So, me, I'm spontaneous. I'll go do something. So I'm sorry, Dr. Warren and Dr. Thomas, I'm spending money sometime. I'm not trying to, but I'm spending money sometime.
And there's nothing wrong with either method. I heard like the quintessential self-care scenario. We heard of bath and candles, and we heard spontaneity, and just the simple things sometimes are self-care. Just listen to your body, listening to your mind, right? And then also listening to the people around you, right? So like, I know for me, folks will tell me like, you're overthinking it, you need to take some time out. And I got to listen to them because they know me. You know what I mean? Like, so that leads me to some of my self-care too. So I appreciate the tips and the definitions and just breaking down what that is. Thank you. That wasn't originally a part of this discussion, but I think it's important for people out there to know, like, you know, there's some things that we can do to promote wellness ourselves. So you talked about working all the time, Dr. Jones. So I want to know a little bit about, you know, any advice that you would have for someone who wants to be in your position, you know, not take your position, but, you know, provide a service to the community. Same question for two other panelists as well, like some advice for someone up and coming or wanting to open a business, start a nonprofit.
I would say network. You know, I was raised to, hey, if you want to be a football player, you need to hang around football players just so you can see how they move. So that old adage is, you know, resonated inside of me. So we have to network. I want to network more with Dr. Thomas and Dr. Warren after this. And, you know, you have to be a good listener to get in this field. I'm big on body language. So, you know, you guys, I'm not assessing you guys, however, it's natural. So I'm looking at facial expressions, body posture. It's just one of the things that I've come to do naturally. But I would say you just have to pay attention to the world around you, because that'll help you pay attention to the person in front of you even better. So those would be my tips. And I did the nonprofit route because I have a computer company. I have those for-profit companies, and I just think that our Black community needs this service. So I want to develop programs through a nonprofit that I can possibly uniquely give away for free at some point when they can't afford it. You know, when insurance say, hey, you only can go to therapy twice a month. I'm sorry, I've wrote thousands of treatment plans and twice a month is not going to work. They need to see me. Dr. Thomas, me and you on the same page. I only work 4 days a week, Monday through Thursday, even when I teach college. Monday, Wednesday class, Tuesday, Thursday. Don't mess with me on Friday. You won't know where I'm at anyway. Okay. But anyways, you know, we need to come together as a community and help each other grow. And I will give those tips if you want to get into the business, want to get into this business for helping others. You know, and it is money. People say it's not money in this business. It's money everywhere. If you need help finding it, just call me. We can make money. We can't make love. Well, okay, I didn't say that right. Okay, hold on. We can make money. Love can't be purchased, right? You can't buy love. There you go.
We're back.
And yeah, now we're back. Okay, I'm passing the microphone now.
All right, I'm gonna catch the mic. Also, Dr. Jones, yes, drop your info in the chat because I need help with getting my nonprofit going. Anyway, so I would love to add to that. Get a mentor. Surround yourself with people in the field. And this is something I actually take time to mentor high school students. I'm a grad of the Sunnyside High School Doctors Academy, and I remember all throughout like my educational career and even starting out in my work career, I was always reprimanded for something, but it came down to like, I have a certain personality, I have a certain presence where I probably just need to work for myself, you know? So, and there are so many youth out there who have that same set of characteristics and it's pathologized, like, oh, they're oppositional. And especially if they're Black youth, they get punished more harshly, they get suspended more harshly. People say they're disruptive, and they get all of these labels when really that is an entrepreneur in the making. Mm-hmm. That is a leader. That is a visionary in the making. And I remember that was a large part of my experience, why I didn't end up being a medical doctor, because no one recognized that, oh, this is a leader. And even kind of early on in my jobs, people were like, well, she's a problem. Like, no, this is a person like she has an entrepreneur spirit. So surround yourself with people who can really cultivate those strengths in you, so you can be able to get where you need to be, because there are a lot of opportunities and you need to be ready to catch them. Yes, even as early as middle school, high school. So if you're like one of those problem children, find somewhere where you can channel that energy. You'll be so much better off for it.
Thank you.
Yeah, I don't have much more to add. You both said it all, but I would just say, if you want to start your own business, or just in the field, just ask questions. I will tell on myself, and when I started my business, I did not ask questions, and I did everything wrong. And I had to redo a lot of stuff. So don't be like Jaryn. Like, ask somebody who's done it, network, get a mentor, talk to somebody. And I don't regret the mistakes that I've made, because I made them. I know some of my therapists who have worked for me in the past, I get texts, coming in, a few times a month asking me about, how to start the business and what process and what things to do. And because I've made these mistakes and I have overcome them, right, I'm able to help them. And I just admire them so much for asking the questions that I didn't ask. So ask questions. Don't be afraid to do that.
I love that. And that speaks to that need for that network and that community of mental health professionals, right? Black mental health professionals. So, yeah, thank you for that as well. So we're coming up on 1 o'clock, and I would like to give this opportunity to each of you. If there's any burning thoughts that you have, or anything that you want to impart on the viewers here today, or those who will watch later down the road, please take an opportunity to do that. And if not, just let us know. I want to give you a chance to self-promote, right? So I see a couple of logos in the backgrounds, but please let us know about your organization a little more, and whether it's a business or nonprofit, and the particular type of work that you do, because I know there's some really exciting things, and we'll leave folks with that before we wrap up.
Look, man, I'm looking at all you guys' logos, and I'm like, I should have asked some questions and got on your guys' level. Next time I'll be prepared. But I guess shameless plug, Joy 360 Wellness, formerly Expressions Counseling Center. We are also hiring for a therapist, and I supervise. So if you are looking for a position, also flexible schedule, kind of like they were both saying, I don't usually work on Fridays. I don't want to. So, flexible schedule. And but for everybody else, so we treat mild to moderate mental health issues. We have Black female therapists right now on staff, so we're just looking for Black therapists in general. And we are offering nutrition services now to support mental health. So if you are just even into the nutrition piece that you need assistance with, we're here to help you. So yeah, give us a call. Go to the website, joy360wellness.com.
Yep, if you didn't hear the first time, LA Psychological Services is hiring. We are hiring for psychological assistants, now called psychological associates. So if you fit that description and you like to work flexible hours and a 4-day work week and a very good competitive salary, give us a call. Or for anybody else who's interested in learning about our services at LA, go ahead and check out our website at www.lapsych.com. That's www.lapsych.com.
The sales pitch is strong. We got to send it to Clear Channel, not Clear Channel, iHeartRadio, because that sounds like it belongs in an ad right now.
Straight commercial. I don't even know if I could go after that. Okay, so we're handling Helping Hands. We offer mental health programs. We have a youth mental health mentorship program. We treat anxiety, depression, conflict resolution. We have anger management courses, parenting classes as well. And we also do vocational training. So our staff is highly qualified. I mean, I have a teaching credential. My staff have teaching credentials. They're clinicians. And we're just really out here trying to put these programs out to our Black community. So I'm talking about, we have a quantum UAV drone program, and we implement mental health into those programs, right? So team building, life skills. We have A+ computer repair. I'm a technician. I'm an engineer as well. So both my degrees and my staff goes with psychology and technology. So we teach cyber hygiene to our early childhood kids and how to keep a clean digital footprint. If you don't know what that means, just kind of look it up, but we teach those classes as well. So that's the plug for Handle It Helping Hands. And that's it.
I'm gonna have to Google cyber hygiene. It's a term I've never heard before. So I'll be looking into that, but we'll wrap up. And I just wanted to thank you all of these amazing businesses and nonprofits are located here in Fresno, in the Fresno area. I know Dr. Jones, I think you have a presence in Southern California as well. But I just wanted to thank you all for being a part of this conversation. It's super insightful. I really just, want to emphasize the importance of us advancing this conversation and really making this the norm, right? Us having these types of conversations in the Black community to address the disparities and the barriers and the stigma and all the things that we face and have faced for so long. So I'm just so glad to see that the work is being done and progress is being made. So I want to also plug something really quickly before we get out of here. This is a part of a series of live stream events that the Department of Behavioral Health has produced for Black History Month. This coming or next Friday, February 25th at 12 p.m., we will be live streaming the Black Church and Mental Wellness, featuring 3 local members of clergy or clergy adjacent individuals who also are mental health practitioners. So I really encourage you to tune into that and to follow along on our Facebook and YouTube pages for more content for Black History Month and mental wellness in general. So I thank you, Jaryn, Reshale, Dr. Jones. I don't know if it's Kenny or Kenneth, so I don't want to guess, but I thank you all for being here, and I really hope that we can do this again sometime soon. So with that being said, we'll wrap here, and we thank you for tuning in, and feel free to reach out with any questions that you may have. So it's been a pleasure, and we will wrap now. Thank you so much for tuning in.